Every 39 seconds, an American experiences a heart attack. Heart disease is the leading cause of death in the United States. February is American Heart Month, and we thought we would raise awareness to how we can prevent this terrible killer. There's a lot of things you hear in terms of advice, dietary restrictions, things like that, but I think the most important thing among everything is prevention is key. Risk factors for heart disease include things like high blood pressure, high cholesterol, and smoking. Those are the big top three. Other risk factors would be things like diabetes and obesity. The beauty of it is all of these things can be prevented and can be worked on if they are already a problem in your life. Two most important things that we hear when we talk about trying to mitigate the risk of heart disease is move more and watch what you eat. As far as moving more is concerned, we're really lucky to live in Door County. We have trails, we have parks, we have all kinds of places where we can get out and get our heart rates up. That's one of the most important things is aerobic exercise, getting our heart rates up because that helps make our heart stronger, keeps basically everything in a better condition. And that's the key, really. And when it comes to doing things, you don't have to do it by yourself. That's always, for me, the most difficult thing is sort of getting up the gumption to go and do some kind of physical exercise. Go with someone, take a walk with someone. If you like yoga, do a yoga class with someone. Those sorts of things will really help. Now, the path to a healthier diet usually starts on our plates. Now, I personally am not one of those that goes along with the concept of if it tastes good, don't eat it. I think that's not true, and I also think that kind of advice isn't helpful. But I think watching what we do eat is important because, again, we're talking about high cholesterol, high blood pressure, things like that, and those can be affected by our diet. You're looking for things like nutrient-rich foods, less artificial foods, lower sodium, things that actually are grown in the ground or on a plant are really, really good. Lean meats, good proteins, yogurt, things like that. I certainly am not an expert, but dietary professionals are really good resources. And while we're on that subject, if you don't have a primary care clinician, or if you haven't seen yours in a while, American Heart Month is a great time to kind of redouble your efforts and come on down and see your primary clinician. Because if you haven't had your cholesterol checked in a while, if you haven't had your blood pressure checked in a while, you may not know that it's high or that it's abnormal. These things don't make you feel poorly. And what you don't want to do is have that very first symptom be a heart attack. So I hope that this has been helpful as far as kind of thinking about our heart and our healthiness. And again, the big thing is preventing disaster before it happens. Take care, and we'll talk again soon.